The worst of America's COVID crisis may appear behind us, but in the worldwide race to vaccinate people against COVID, Africa is falling way behind. This continent of 1.3 billion people faces a staggering shortage of vaccines, just as a new wave of infections sweeps across some countries. CBS's Debora Patta reports from South Africa.
Nurse Menzies Nkomo is up with the rooster's crow. He's trying to stay strong after fighting the pandemic for over a year with nothing more than a mask. But with no vaccines available in the tiny kingdom of Eswatini, he's not ready for the third wave.
Our country does not afford even the simple treatment for the COVID patients.
Worried about infecting his family, he lives at the Nkwene clinic. It's the first line of defense against the virus for the local community. The fact that the US is already vaccinating children is cause for hope, he says. It's just that hope is not for him.
You know that there is something that can assist you, that can save more lives, but you can't access it. It's so painful. It's like we live in another world.
The country has already exhausted its meager supply of vaccines. Just over 30,000 health workers have received their first shot. Nkomo was not one of them. If wealthy nations are able to vaccinate children, they should be sharing excess doses, believes South Africa's pandemic advisor, Dr. Salim Abdul Karim.
To me, it's unconscionable that a country vaccinates low-risk people when a whole lot of other countries, especially in Africa, haven't even vaccinated their healthcare workers. That's an unacceptable and ethically and immorally unacceptable situation.
Africa has only received under 50 million doses compared to the over 2 billion administered worldwide. And there are enough vaccines to tackle the global shortage right now, says the head of Africa's CDC, John Nkengasong.
So we are not actually begging for vaccines. We are just saying, let's have an arrangement where you can delay your vaccines a little bit. There's absolutely no reason why in some countries you have 4 or 5 times more vaccines sitting in deep freezers.
The enemy, he reminds us, is the virus. Menzies Nkomo knows exactly who that enemy is, and that lifting weights won't keep COVID at bay. His only real weapon is a vaccine.
Africa was relying on India for vaccines, but that supply has been halted due to their own COVID crisis, so donations of American vaccines will be most welcome. Debora Patta, CBS News, Johannesburg, South Africa.